Yes. Hello, everybody. Today we have a really special guest. We have Vanessa Carter from the AMR Awareness. Vanessa, would you mind telling us A, what is AMR Awareness, and B, who are you? What's your background a little bit?
Yeah, thank you so much, Bart, first of all, for having me. It's such a pleasure to be here. And let me explain a little bit about my background. So I'm an AMR survivor. I'm a patient that underwent a 10-year facial reconstruction following a car accident in South Africa, Johannesburg, as you can hear by my accent. I battled with highly resistant infections on my face. So you can kind of see the damage. I mean, it looks a lot better now, but during that time, I had sections on my face sort of amputated because of the resistant infection that I had. So that particular infection that I had was called MRSA, methicillin-resistant Staphylococcus aureus, which is a really big mouthful for most people. But I also battled with osteomyelitis, which is a bone infection where I nearly lost all the bones in my face. But also during the car accident, I damaged a lot of the bones as well. So the reason why you've asked me about the AMR narrative. This is a charity that we started in 2022 with no funding. And in 2023, it was officially registered in the UK. The reason for that, we have three pillars. Our first pillar is to develop advocacy capacity development. So the reason for that was, my vision as the founder was because we are lacking patient voices in this space. And so me as a patient, when I first started, I didn't understand how to do that. And so our first pillar focuses on advocacy capacity development to help people, whether they're coming from their hospital bed to say, I really want to talk about this. This bothers me. This AMR issue bothers me. Nobody's communicating it to me and so on. I don't understand it. So our aim is to try to empower them to become involved in the advocacy space. The second pillar is education and awareness, because not everybody wants to become an advocate. Simple awareness raising helps them to become self-advocates, to understand what's happening to them, and to question their doctors and have a conversation with their doctors at least, in terms of what AMR is. And the third pillar is developing a global community. So we believe in partnerships, and of course you're interviewing me right now from the Aspergillosis Trust. We believe in developing those meaningful partnerships, because AMR it doesn't just focus on one disease. It impacts every single pillar of medicine. Whether you have aspergillosis, whether you have a urinary tract infection, whether you have neonatal sepsis, whether you have, whether you're an immune compromised patient, or you go through surgeries, AMR is cross-cutting through all of those different things. So we believe as a charity that, kind of like the rare diseases community brought together those different stories under one umbrella. Collective voices can make a difference, and we all need to be working together.
So Vanessa, just for the sake of it, I don't think you said what the letters AMR stand for. It's pretty obvious, but if you don't mind.
Sure, Bob. Thank you so much. Yeah, so AMR, in English terminology, mostly means antimicrobial resistance. Very, very difficult word for most people to understand. But AMR, I guess, is kind of like, if you think about COVID, coronavirus, SARS-CoV-2, all these different terminologies we've heard in terms of COVID-19. AMR represents when different types of germs or infection-causing microorganisms, such as bacteria, fungi, viruses, or parasites, develop resistance to the medicines, such as antimicrobial medicines that were designed to treat them. So, for example, in my case as a patient, I had antibiotic resistance, and that falls under the AMR umbrella, right? Antibiotic resistance meant that I was the bacteria in my body had become resistant to the antibiotics I was taking. It also covers antifungals for fungal infections. It also covers antivirals. So there's some patients that we have worked with who have, for example, had drug resistance to HIV medications. Of course, we know HIV is a viral infection, and also antiparasitics. So there's some patients that we work with as well that have been developed drug resistance to anti-malarial medications, and those are classed under the antiparasitic medications. So, of course, AMR again is, think about it this way. We humans haven't been around for that long. Bacteria, viruses, parasites, and all these small little germs and microorganisms have been around for a long time. So we developed medications not so long ago that help to defeat us with these diseases. So so unfortunately, we need to be proactive in terms of realizing that, we're going up against Mother Nature, and antimicrobial resistance means that we're trying to fight these different organisms that cause infections, and we're not actually winning the war at the moment unless we come together and we start realizing that this is a major problem.
So thank you for highlighting antifungal medication, because like most of the viewers here will be taking that. I'd also want to remind people that I did an interview with Dr. Joanna Rhodes on that same topic, which you can find on the Aspergillosis YouTube channel. But now, going back a little bit, as you rightly say, we're a pretty new species in the global context. And actually, AMR or relevant has only been spoken about the last 10 years or something like that. Do we know how widespread this is, how real the threat is?
If I want to honest, give you an honest answer, I think that we do, but we don't, because I think that probably one of the biggest things is the issues and the gaps in surveillance. We aren't monitoring it enough. However, I mean, looking back at the history of antibiotic discovery, if I just focus on bacterial infections for a second, Sir Alexander Fleming discovered penicillin back in 1928. It was, put into widestream medicine in the 1940s. And we already saw resistance. He already saw resistance emerging from that. I don't think we've taken it seriously enough. The global impact today, in 2019, they did release a Graham report, the Global Research Antimicrobial Resistance Report. And what they captured was that 1.27 million deaths were directly caused by resistant infections. And it is projected that AMR could cause up to 10 million deaths annually by 2050. And this is kind of like, I think what people confuse with, they say, it's going to be more than cancer. I think people kind of look at AMR and they say to themselves, well, this is another disease. It's not a disease. It's an impact of a disease. It's something that impacts a disease. And so we need to be taking it more seriously, recording it more seriously. And even more frustrating at the moment is that, you can hear, again, I said to you, I come from South Africa. Regional disparities, low and middle income countries are even more at risk, and so, but we can't, as higher income countries, neglect that, because these diseases, AMR, these microbes, if you want me to use that word again, germs, think about it as germs. Germs travel across borders, and so we can't treat it in isolation. So I advocate very strongly about that as well.
Thank you. And by the way, my understanding is that the UN has recognized AMR as a global risk. And that brings me to my next question. Like, is this all doom and gloom, or are you aware of interesting developments, scientific perhaps, that give you hope?
It's not all doom and gloom, but I think we also need to face the reality that we if we look at mortality and morbidity, mortality, meaning that we live with the consequences of AMR. I mean, for my sake, I've lived with a facial difference, a facial disfigurement. I'm a disabled person. AMR infections, in other words, resistant infections. If you get an infection on your leg, for example, and it doesn't clear, they might have to amputate that leg off. They might have to amputate that arm off, or whatever. In my case, it was amputating sections of my face. And then of course morbidity meaning, or mortality, at least mortality, meaning that we can die from these infections. So, when you say doom and gloom, there is a lot of doom, there is a lot of gloom, but there's also hope. And I don't like to advocate to say we have no part to play at all. For me as a patient, the way that I overcame my resistant infections was to become more empowered, to educate myself, to practice better hand hygiene, to take my antibiotics more strictly, to educate myself, to work with my healthcare professional. And I think that on a global scale at the moment, what is happening as well is there are antimicrobial stewardship programs taking place. I mean, the medical professionals are doing a lot. Also, this is probably a controversial topic, and I hate to talk about it, but vaccinations. And why do we talk about vaccinations? Is because if you vaccinate in the first place, you might prevent a disease that doesn't require antibiotics in the first place.
Yeah.
Global policies. This past year, I've spent my time at the United Nations General Assembly. I opened up the multi-stakeholder meeting where we pushed on, how do we use participatory approaches to understand what patients need for patient-centered approach in that term. So they did adopt that recent UN political declaration. And thank goodness, because people like you and me, you living with aspergillosis, we need to be speaking up and we need to be creating change. And then finally, investment. There's not enough investment yet. There is a bit of investment going into AMR. But if I speak from a patient level, not enough yet in terms of understanding our personal experiences and how we can contribute on an individual level to creating patient-centered policies.
Yeah, that's really impressive. Just like I think you alluded to that, but like if I was say, okay, obviously I am a patient, like, and there's nothing I can do about that. But can I help myself to say, okay, I will try not to get AMR? And I know, like, there's always like you're in hospital or whatever. It is what it is. But on a more generic level, what can our viewers do?
Like I said, I think what I always hear about and what I did myself was obviously to practice hand hygiene a lot. I live with multiple prosthetics in my face, and so I've been really taught the basics, of how to take care of myself. Also, I think just making sure that when you do suspect an infection is not going away. So I also, for example, live with recurring allergies. My face sometimes inflames. I get autoimmune responses to certain foods and so on. Maybe to try and figure out, is this something that's an infection? Going to my doctor and asking and really, just saying and realizing that if something's not going away, it maybe needs a diagnostic test, and putting a little bit of pressure on our doctors to do that. Something that I did as a patient as well is I would stop my antibiotics halfway, not realizing that wasn't my fault. I kind of involved myself in my own pathway, but I also think to myself, I felt very ignorant in terms of what antibiotic resistance was, and I felt if I had known, I might have made a more informed decision to not stop my antibiotics halfway, or at least take them at equal intervals. Again, I think diagnostics, that's missing. Not knowing when an infection is going away, speaking to our doctors and realizing that there is something called antibiotic resistance, and informing ourselves, educating ourselves, and knowing that we have a right to ask.
Yeah, Thank you very much. And as you said, I think I can tell you that the vast majority of our audience will be very pro-vaccine. So I think you don't have to worry that people would disagree with that, because you're right. Like avoiding these extra problems is clearly going to be super beneficial as well.
Yeah.
Um, like, how do I know that I might have some AMR? What's the signs you think?
So I think certainly prolonged or recurrent infections that don't respond to standard treatment. So in other words, if you are, in my case, I was prescribed an antibiotic. It wasn't responding to that antibiotic. And back in those days, we're talking like 10 years ago, I would go, well, I didn't understand how it was working. So I would go, well, this antibiotic's not working. Maybe the doctor's at fault. Maybe I should go see another doctor, because I was under the care of a multidisciplinary team. I think it's important to know that if your infection doesn't respond to an antibiotic, antifungal, or other type of antimicrobial medication, you need to question that. You need to go back to your doctor and you need to ask why. And as I say, maybe even question if you can do a diagnostic test to see why. Because in my case, what happened was they did a diagnostic test. This was like 11 months later. And when I got that diagnostic test back, wow, there were just lots of R's and S's, and I was like, how do I read this thing? So the R's meant I was resistant to the type of antibiotic on the left, or the S meant I was susceptible to the type of antibiotic on the left. The problem was I was being prescribed the antibiotic that I was already resistant to. So
Yeah.
diagnostics are a massive problem. They are a massive thing. And so, again, try and work with your doctor. Raise alarm bells when the infection doesn't go away. Again, it's not going to be the same issue in every single situation, because if you have sepsis and you have a resistant infection, you don't even have time to go and ask your doctor to do that. It's up to the doctors to do that. So I think also it comes down to patients educating the doctors at the end of the day. We need to have rapid diagnostics. We need to understand exactly what's happening to us straight away.
And that brings me kind of to the next question. If unfortunately you would have a form of AMR, would you have to worry that you would spread that to the people close to you, friends and family, or how does that work?
Yeah, so unfortunately, what we're talking about is infectious diseases. It's infectious, and the word infectious is important. COVID, I think we learned quite a lot from COVID. COVID was a virus. We learned a lot because we learned about things like touching objects and how long that virus could live on the object. If we know with flu and colds, again, both viruses, where we hug each other, we kiss each other, that virus can spread. So is exactly the same, because it falls under the same umbrella. Anything to do with infections is infectious. So absolutely. I mean, I didn't know this when I had MRSA. I didn't understand it. I went home and I was, I had a baby back then. I was raising my child, and, I'd pick him up and hug him, and, my whole face was infected with MRSA. But what could have happened, luckily it didn't, was for him to get it on his skin. And thankfully he didn't get an open cut or wound, and it ended up in his body, So absolutely. So this is also why I say, and we saw with COVID, keeping distance, washing our hands, and it's not just in human health, Bart, it's not just in human health. Unfortunately, AMR is a One Health issue. So in other words, at the moment, they're busy researching antimicrobial resistant microbes in waterways, in animal health, the overuse of antibiotics in animals, agriculture. And so we as people, as consumers, we need to understand better what that means to us. Does that mean, we already know, like, food preparation and food safety is a huge issue, right? Think about the word germs. Germs are everywhere. Germs are everywhere.
So I think amazing what we've learned in such a short time. You explained, your background, the MR narrative, the fact that it applies to fungals, the sort of overview of the threat. We spoke about, that can be resistant. And actually, I have one more final question for you, which is, I think a lot of our people that were watching this will want to know more and might even want to get involved, because this is very close to us. Like, most of us know this, more not with the detail that you brought. I knew this, but you brought a lot of knowledge here. So if you want to know more, the website, if you want to get involved, what would be the best way to do that?
So we as a charity, first of all, we don't claim to know everything. I think the AMR narrative is about partnerships.
Yeah.
And working with other people and helping them to bring their stories to light. And so that's why I said, like, the 3 pillars are really about, I've been a patient advocate for the last 11 years. I've gone from being in a bed, almost dying, from different conditions, to, working with researchers, working in medical education. This year at least, I went and I spoke at the United Nations General Assembly. I was sitting at a table with the very high-profile people, the Deputy Secretary General of United Nations and so on, General Assembly President. For us, it's about helping advocates get to that point. I realized something very early on, was sort of midway to my advocacy, and that was the case that my story can only go so far. And so our charity is about helping to raise the voices of others. And again, it works on partnership. So what you're doing at the Aspergillosis Trust is absolutely incredible. And we, as I say, we believe in, like, how can we, what sort of resource can we give you? There's been one resource, for example, where we just launched right now, which is a social media advocacy toolkit, where if people want to get onto social media, they'll say, well, where do I begin? What social channels do I choose? What type of message do I disseminate? And so we're also working on an online course for next year, where we could share experiences from other patient advocates and so on. So I think, to answer your question, follow our website, follow our social media, get in touch with us. We've got, share your story with us. We've got a section where we share stories as well. And again, for us, being patient-led, it's all about driving that advocacy and not really much else. So, so it's a pleasure to work with you guys at the Aspergillosis Trust.
So thank you very much for taking the time. I thought it was an amazing discussion. Please, as Vanessa says, look on the website, look on the socials, and get in touch. And with that, I think we can end the interview. Thank you very much, Vanessa.
You're welcome. Thank you so much, Bart.